Well, let's get into our news belt now. Thank you for staying. And in our first story, an easy calm has returned to WAC Technical Institute in the Upper West region after a final year student was alleged to have assaulted a housemaster, injuring him in the right eye. Yusuf Mudashir was said to have been improperly dressed and was asked by the housemaster to go and change his attire, and at order, he refused. Rafiq Salam now reports that this resulted in a fracas with a student picking a stone nearby and hitting the right eye of the housemaster.
WAC Technical Institute, one of few second cycle institutions in the Upper West region that usually hawk headlines for the wrong reasons. There at it again. A final year student of the institute, Yusuf Mudashir, is alleged to have assaulted housemaster of the Bala House, Ismail Musa Furko, injuring him on the right eye.
I approached him and then asked him to go and change and be like a normal student. That was all that transpired. And he agreed to go in and change. After entering the yard, he was resistant to do what I asked him to do. So I just held the shirt and asked him to hurry and don't waste my time here. And all that came from his mouth was, "Master, what do I do? I don't like it." I said, what did I do? I only asked you to go and change the improper and wear your uniform, that's all. Then we're walking on the pavement blocks. Then he went down the unpaved floor. I never knew that was his intention. So all that I could realize was he just bent down and got up and once and used a stone and hit me.
How did you feel when you hit you?
I feel pain, and blood was oozing from my right ear and my nose too. The blood was also coming from my nose. So that was how we picked him from that place and sent him to the master in charge of discipline.
So this student, have you forgiven him?
Actually, why not? I'll claim to go.
So you don't want anything to happen to him?
Oh, no. Nothing actually.
Principal of the college, Saka Adams, disclosed that his alleged accomplice and bosom friend was also arrested for allegedly using a pair of scissors to injure a colleague student. The duo are currently sick at the WAC police cells pending investigations, while the housemaster was also treated and discharged at the hospital.
So when that happened, that particular student have got a very close friend who was also in the dormitory. So when you saw that, he also wanted to run. The students wanted to grab him. Not knowing he was having a scissors in the pocket. He removed it and took one of the students to hand. So we had to pick that student to the police station. As we speak currently, the students are at the police custody and they are going through investigation.
This morning, tutors at the WAC Technical Institute converged at the forecourt of the administration block in solidarity with their colleague to serve notice that they were not going to invigilate the final year technical drawing paper of the CT vet examination unless the student was sacked. The incident prompted the principal of the institute to meet with the tutors of Kamara that Captain sought the boycott.
So I was telling them for the invigilation is optional. Why you don't? Because we don't owe the exams. So they can go out and look for people to come and invigilate. So when I talk to them, they understand, and I assure them that the safety of the teachers in my school will be one of the management concerns. I'm still assuring them that the students live in any fear. This is the first time we experience this, and I don't think it will continue. When we have taken measures, the students themselves have seen what happened. Tomorrow, if you also commit the same crime, we will hand you over to the police because this is a criminal act.
Though he agreed hook, line, and sinker with the tutors that what the student did was wrong and condemnable, Mr. Saka doesn't believe that the baby should be thrown away with the bath water.
You know, TVS service have brought a policy. We call it the guardian and counseling policy. The policy is that to handle students who are going wayward. So we have some students in the school, and some of them have gone through this guardian and counseling, and they have reformed. So our hope was that these students would have reformed. But you know, you can't have 100%.
Because you said that you have this guidance and counseling on your part.
Yeah.
Dying embers, very few, some few days for him to end school.
Yeah.
And this can happen.
It's not a failure on the management part. I said, out of 100, if you're able to reform about 92, it's not a failure. This is just once, but most of them have reformed. And they are conformed. I mean, they are conformed to the school rules and regulations. And they are doing very well.
The exam that was supposed to start at 9 o'clock is now ongoing after 30 minutes. Reporting for the news, Rafik Salam. Wow.
Now, some aggrieved residents of the Kwame Danso area and its environs say they are living in constant fear following incessant robbery attacks in the area. Members of the Gun Youth Association at a news conference appealed to district and regional authorities to institute measures that would curtail the menace after 2 persons were shot and killed by armed men last Saturday.
There is a problem. The Kwame Danso we used to know is a peaceful town some times ago. But today, what we are seeing is not appealing at all. It is destroying the good name of the town that our ancestors built.
These are aggrieved residents of Kwame Danso, the capital of the Sani-West district of the Borno East region, expressing their displeasure at the recent increase in armed robbery incidents in the area. It will be recalled that 2 persons were shot dead, leaving 3 others with various degrees of injuries after a shop was attacked by armed men on Saturday, July 22, 2023. Banka Kwesi is the deputy PR of the Gun Youth Association.
The attack on a shop at Kwame Danso by armed men, claiming 2 lives and leaving 3 others sustaining various forms of injuries, and on Saturday, July 22nd, 2023. This happened at exactly between the hours of 7 and 8, when there was a power outage. 10 minutes after the power outage, the incidents occurred.
The youth, with support from the community leaders and Nananom, say the hike in criminal activities in the area continue to serve as a threat to lives and properties, a situation they say is as a result of the poor road network of the district.
We have keenly observed, gathered, and can contribute the unbearable attacks on our roads, shops, to the following. Our poor, devastated, deplorable nature of Atebu Kwame Danso Road is key factor, like I've already said, including all the feeder roads in the district, bad roads, and then bad networks. These are issues that we are talking of. So, as you are hearing from us today, we want all the media houses to emphasize on this to help us.
These aggrieved residents asked that the recent attacks has left many living in fear, a situation that is causing the people to sleep early at night.
Economic activities is unbearable. It has come to a standstill. All the filling stations in Kwame Danso, after 7 p.m., you will not see any of them operating. We have decided to impose a curfew on ourselves. Recently, what we are seeing is that exactly 8 o'clock p.m., all stores in the town will be closed. Nobody can go out and buy something.
They therefore send a passionate appeal to district, regional and national leaders to come to their rescue to help save lives and properties.
No. I believe you are here this morning because these issues of killing and armed robbery activities, you are not happy. The same thing, nobody is happy. We have sent a petition to the IGP and also copied the below actors. IGP, Interior Minister, Defense Minister, members of our Member of Parliament for Sydney West, Honorable Kwame Danso, Bunu East Regional Minister, the District Chief Executives, that they should come to our rescue. People are dying. Innocent souls are dying.
District Chief Executive of the area, John Inyaba, after receiving the petition presented by the youth, promised to champion this cause as he works towards beefing up security of the area.
adenti na 7 o'clock ade ensaye na de obehu aprako pese etuo etotototo sesei obia ehu aka obia ho enti anamu a as a district chief executive and assembly yenso yetu ni say we will beef up the security but yankwa ya na montuo no eusa enti next week sesei na me ka kire elder say ahemfo be 4 plus the youth leadership so be call regional minister ho 1-on-1 no we hu say yani abre.
Also present at the press briefing are the Bamuhini and Binkumhini of the Jan traditional area. Anna Sabit, Joy News, Kwame Danso.
Now, maintaining optimal indoor air quality is essential for ensuring environmental health and safety within constructed spaces. One prevalent indoor air pollutant that poses direct risk to the eyes, respiratory system, and the central nervous system is formaldehyde. It causes headaches, dizziness, tearing, and nausea. Fortunately, researchers at the Kwame Nkrumah University of Science and Technology have developed a device capable of breaking down formaldehyde into less harmful substances. Love FM's Kwesi Deborah has more in our Tech Thursday installment.
According to the World Health Organization, formaldehyde concentration in indoor air space should be strictly regulated at 0.1 parts per million. However, some studies have shown that formaldehyde levels found in some enclosed areas exceed the WHO's recommendation.
From minor to acute, mild upper lung respiratory disorders, heart disorders, even child mortality and shortened lifespan has been connected to pollutant in the air. Another crucial thing about air pollution is that there is the development of photochemical smog. This photochemical smog, in order not to bore your listeners and your viewers, it's a kind of a reaction between certain volatile organic compounds and nitrous oxides agent. In the presence of sunlight, they form ozone and other things that are depleting our environment. And if you are a lover of the news and you follow what goes around in the world, you realize that people are talking about climate change, climate change. So, in a nutshell, I'm trying to say that air pollution is crucial because when we have harmful pollutant species in the atmosphere, they cause diseases.
The device, known as dielectric barrier discharge reactor, uses electricity to break down formaldehyde into less harmful substances like carbon dioxide and water. The results of the study, published in the journal Scientific Reports, indicated that the device efficiently removed low concentration formaldehyde by 99%.
You can place them, it's an indoor device. You can place them indoors. And you can fix them in industries where we have the venting, where these volatile organic compounds are capable of exiting. It will suffice for me to mention that this device we have produced to do the environmental remediation or cleaning up is also a suitable reactor for the production of hydrogen fuel. If economies would develop and become robust and resilient, energy is very important because now the world thrives on materials, energy, and the environment. The developed world are developing in terms of industrialization because they have enormous amount of energy. So this kind of reactor, what it can do is to try to convert atmospheric pollutant, for example, carbon dioxide, into more hydrogen. And that is the most sought for fuel in the world at the moment, as I'm talking to you. When it does, it produces hydrogen gas and carbon monoxide. This carbon monoxide can be combined with ordinary water, in a water gas shift reaction to produce more hydrogen fuel. The other thing we can do is to use it to sterilize even hospital equipment.
Reporting for Joy News, Kwesi Deborah.
In our next story, Northern Regional Minister Alhaj Shani Al-Hassan Shaibu has revealed that only 11% of Tamale residents have toilet facilities. He's described the situation as worrying. Alhaji Shaibu spoke at a ceremony to inaugurate the Tamale wastewater treatment plant in Balahi, a suburb of Tamale.
The Tamale wastewater treatment plant is the fifth wastewater treatment plant to be constructed. The plant has a capacity of 1,000 cubic meters per day, built with a comprehensive European treatment technology. It's expected to help deal with the sanitation situation in the area. The Northern Regional Minister said the inadequate public and household toilets in Tamale has resulted in rampant open defecation in the metropolis.
The increase in population obviously translates into corresponding increase in the amount of fecal matter generated in the metropolis. Latrine coverage in Tamale, according to Tamale Metropolitan Assembly, is about 11%. The inadequate public and household latrines in Tamale has resulted in rampant open defecation in the metropolis. This is evident in the air quality and resultant related diseases.
The chief operation of the board chair, Dr. Joseph Sian Japan, said the facility is expected to generate 300 direct and indirect job opportunities.
The Tamale wastewater treatment plant has the capacity to treat 1,000 cubic meters of fecal matter per day, using a comprehensive European technology. This commissioning brings to the fore 5 of such plants.
Well, now, in our next story, some water supplying companies in rural communities in the Ashanti region are demanding payment of arrears after providing free water to consumers under the COVID-19 relief package. In April 2020, President Akufo-Addo announced a utility package to absorb water and electricity bills for lifeline consumers for a year. However, some community water suppliers say they are yet to receive payment for services provided. There is more in this report.
At the just-ended second conference of the Network of Community Water Services, NETCOWAS, managers of community water supplies at Kuntinase, Buenim, and Ankasi said the government owed them at least 140,000 Ghana cedis. The three communities are part of several others across the country, owed cumulatively over 1 million Ghana cedis. In spite of several letters and visits to local assemblies for payment of the arrears, the managers insist their calls have fallen on deaf ears. Emmanuel Opon and Emmanuel Aban speak for the Buenim and Ankasi water supply and sanitation areas respectively.
The system did well in supplying free water for 1 good year. We've done our best going to the district assembly, contacting the CWSA how to get this money, but still we are not getting it. Though they've paid some, the total amount was around 3.3 and something Ghana cedis. But they've made some few payments and now they are owing us 151,000 Ghana cedis.
We use about 140,000 to produce water to the community. And our sister community, which is Kuntinase, there too, the government is owing Kuntinase water system 150,000 Ghana cedis.
The outstanding balance, according to them, is hampering their operations with imminent threat to water supply in these areas.
Quite recently, our pump developed faults. Somebody assisted at about 26,000 before we were able to repair the pump. So we have and electricity too. They are demanding their electricity base, and we are owing electricity by about 80,000 because of the free water. In case the government fails to pay that cost, it means we are not going to sustain the system. As very soon we will be heading towards the dry season, our communities who face water problems very well.
Their concerns are among other challenges, including ongoing road construction works confronting members of the NETCOWAS Community Water Services in Ashanti region. Impo Bihine Nana Owusu-Tapon is president of NETCOWAS.
As we have set this NETCOWAS up, NETCOWAS is not only for the sustainability of the water system, but we are also forming a forum whereby our voices can clearly be heard. Because if only one community goes to talk about the monies promised to them, which are not being paid, it will not be effective. Like maybe 10, 20, 50 communities together, their voice will be much more heard. That is why we are entreating other communities to come and join NETCOWAS so that we will form a bigger forum where our voices will be heard.
For Joy News, my name is Emmanuel Bright Kweku.
Now, the Registrar of the Health Facilities Regulatory Agency has lauded the commitment of the Christian Health Association of Ghana to improve healthcare delivery within its facilities across the country. There is more.
Speaking at the Maiden Quality Safe Care and Quality Improvement Awards, organized by Farm Access Ghana and Safe Care in collaboration with HEFRA, Dr. Philip Anobano said the Quality Improvement Partnership with Safe Care helps the Health Regulatory Agency to work towards minimizing errors in healthcare delivery and promotes quality healthcare.
Minimizing errors and promoting what is good. Recently, there was, I think it made the news. In the U.S., I have the U.S. data, so not because I favor them over any here, but I have the data from there. Nearly 800,000 people either died or suffered serious disability or sequelae from missed diagnosis a year. 375 of them say died. So the 425,000 suffered a disability. It means that you have to live with this. So with that as a background, we have reason to work together. And for Safe Care and pharmacists and for everybody here, I thank you and I thank you and I thank you. I can't say thank you enough. Let me tell you what this does for HEFRA. I'll get to that in a minute, but let me go over some of the issues first. So, issues like hospital-acquired infections. You don't go to a hospital to get an infection, do you? You're supposed to get better, so we must work towards that.
Speaking to Joy News after the awards, the Executive Director of the Christian Health Association of Ghana, Dr. Peter Yeboah, said 91% of all SHAG facilities accessed by Safe Care have recorded performance improvement since 2020. Dr. Yeboah added that by using the Safe Care standards, the country can push to attain global standards of healthcare. In all, 8 facilities and organizations that have made remarkable progress in establishing and implementing systems and processes towards individuals who were awarded, along with 7 individuals were dedicated to promoting and facilitating quality improvement in various healthcare facilities networks in Ghana. Safe Care helps healthcare stakeholders in emerging markets to bridge the quality gaps today for a safer tomorrow.
And so for the past 3 years, in collaboration with pharmacists, we have adopted and embedded the Safe Care Quality Improvement Program to ensure that our systems, our environment, our staff, organizational environment reflect our ideals and values of our highest accountability with respect to the mandate that we have to promote health and healing, and we do so aware that quality is probably the single most important structure, system, process, or outcome that is expected within the entire health sector. We believe strongly that for CHAG, we are the anointed and appointed guardian of safety, best experience in healthcare, and of course, effectiveness in the way we package, define, defend, and we deliver health services.
Karen Obin's report read to you.
And that's how we wrap up the news for the morning. But stay with us. The news review is up next.